Coming up on 8:15 now, May is Mental Health Awareness Month. It's estimated that 1 in 6 adults suffers from a mental illness. But a lot of people won't ask for help. Dr. Humberto Temporini is a psychiatrist with Kaiser Permanente, here to talk today about some of the stigma that is still attached to mental health. Thank you for coming in today. We appreciate it.
Thank you for inviting me.
Of course. Let's start with that statistic, because it really is incredible. 1 in 6 adults. When we say that, what types of mental illness are we talking about?
We're talking about every mental illness in general. So just for you to get a sense of this, we have about 44 million people that have reported mental illness in 1 year in the US. Of those, about 16 million are people who have reported incidents of depression during that same 12-month period.
16 million people with reported depression. Why don't we define what depression is?
Absolutely. Depression is what we call a mood disorder, basically a disorder in which it's difficult to regulate your emotions. There are a couple of things that people with depression typically experience. One of those is obviously feeling depressed, sad, hopeless. And the other thing that can certainly happen is the person's inability to enjoy things that they used to like before.
So these are signs, because I was asking you in the break, how do you know if you're just going through a rut, kind of bummed out about whatever, or you're tired, stressed, between being truly depressed?
Absolutely, because as you know, we're people, we're not machines, we're not always in a good mood, right? And it's okay to be in a bad
Everybody's
mood.
in a good mood here.
Absolutely, I can see that, I can see that.
Right.
So what we see is that the key element that defines what depression is the person's inability to do the things that they were doing before. So the day that the person cannot go to school anymore because they just cannot get up from bed because they cannot face the day.
Right, or if you're a parent and you have trouble taking care of your children or getting them to school because you can't get out of it.
Absolutely, so that's what we call functional impairment, which is a very, very important thing in mental health.
Two of the other ones that you had on your list were sleeping too much or too little, problems concentrating. Again, those are very common things for people.
Absolutely. So that's one of the things that we always want to basically give information about, because there are lots of things that go along with depression that by themselves do not make depression. So in order to have depression, you need to have either this very sad mood, very depressed, where people feel like this very distinctive quality of sadness, or the lack of enjoyment in all these other things that they were doing before that they're no longer doing.
We have about 30 seconds left, but there's a fear of the stigma. Do you think that that's improving somewhat? Because there have been a lot of celebrities, lately especially, who have been very open about saying, I've been going through this, this is what I do to be able to continue meeting my obligations in my life. Are we getting better on that?
We are getting better, but we still have ways to go. We know that, for example, 36% of people who have a diagnosis of depression or anxiety don't report having that. Compare that to 11% of people who have diabetes and don't report that. So it's a significant issue with shame and concern about what people will say when we tell them that they have depression. And
real quickly, I know you guys are announcing at Kaiser some pretty sizable grants that are going to be helping study and fund some of these things.
Yeah, so we're basically giving out $2 million in grants to Northern California that will benefit about 7 community organizations in our area between Fairfield and Modesto, and they're geared at decreasing the stigma associated with mental health. We're talking about schools and community organizations here.
All right. Well, thank you very much. We appreciate you coming in and illuminating us on how common the problem sadly is.
Yeah, thank you for having me.
Absolutely. Thank you.